I don't know. I just sat down. So.
I'm glad you did because I was in the back and like, I'm not going to be the first one.
That's what I know. I walked out to Jen and I was like,
Yeah.
It's all right.
Yes.
Where's your office?
We're in the Peterson Tower on the 6th floor. Yeah. Okay. Centrally located, people can find us.
Yes.
In bright, shiny blue building. So I was wondering, because the sun was shining today, I wonder how many people in person, because they also have their live stream option. So if I wasn't speaking, I might be like, yeah. Hi, Claire. How are you? So things didn't turn out.
Hi, I'm Judy. Nice to meet you.
Yeah, we were manifesting. But now we have to. Well, these aren't much interesting. I think others are. I mean, I guess
I don't really know what they changed.
I don't think anybody does. Because everyone was waiting on language. Supposedly, PEPFAR is fine. They just struck the substitute amendments, just struck that language. So PEPFAR is fine. But I don't think they did anything on the tribal station. That was just like really wrong. Representative, how are you? Hi, I'm Karina Walrus, Senator Murkowski State.
Hello, how are you?
Nice to see you. It's been a long time.
I'm so sorry. I want to be able to tell you that it's fine. No, for sure. I know. Oh, that's my bad. Yeah.
Oh, hold on. One more. Give me T-Max.
And it failed, and the discharge failed. Now they can bring it up again when it's in session, right? But then it failed, but that gives time.
I think it's over because
Okay. This is the order we're going to say all.
Oh, no pressure.
No pressure.
No pressure.
You go first.
Yeah, great.
Yeah.
Awesome. I was
Okay.
ready for
This is
that.
the order, y'all. Good. Okay.
Does that mean because I go after him, I'm in trouble?
Where is that?
Let's start. Hey y'all, I just want to say thank you for being here. If you do not know me, I'm Rabbi Abram Goodstein, and you're at Congregation Beth Shalom. Just a few housekeeping announcements before we continue. So bathrooms are just down the hall this way, and as you face this way, they're on your left, okay? We are live streaming this event, and the camera for the live stream is right there. So if you don't want to be on the camera, just sort of stay away from that angle, okay? This is a potluck, so there is food. If you get a little hungry, feel free to go grab some. We ask that you just don't bring the food over into the sort of the carpeted area. So that's that. And I also, as a final thing, I want to thank all of our panelists for being here and joining us tonight. They have very busy schedules, and yet here they are talking to us and helping us understand this reconciliation bill. So I just want to thank you guys. Appreciate you all. Yeah. Okay, so what is a symposium? Question has been asked to me a lot recently. And I believe that a symposium is more than just a panel of experts to help us understand important issues like this reconciliation bill. I believe that a symposium is an exchange of ideas. That after we hear what these experts have to say, we stick around, enjoy the food from the potluck, not just to process the sobering information that we are about to receive, but to think about what to do next, because a powerful idea of what happened next to be sparked right here this night, but we can't know until we get enough of us together and exchange our ideas, our thoughts, and our feelings. So I encourage you to stick around and afterwards to schmooze, because on a night like tonight, schmoozing could change our world. Anyways, symposiums like this one are not possible without your generous support. So you may have noticed QR codes around for your donation, and any donation that we receive tonight, we're going to give half of it to Alaska Family Services. Randy's in the table right out there if you want to learn more about what they are and what they do, but many of their clients are going to be affected by this reconciliation bill. And so I think it's really important that we highlight organizations like Alaska Family Services. So thank you for your donation. Okay, so the format for tonight. So we have 7 speakers, and each one's been given 10 minutes. Wish I can give them a lot more time, but otherwise we'd be here forever if I did. So 10 minutes each, and so they're all going to speak for 10 minutes, and then afterwards I'm going to open it up to questions for 20 minutes. And to ask a question, you have to come up to this mic right here and ask it, and just FYI, the mic is actually in the way of the camera. So you'll be on camera when you ask your question. Just want you to know that. And we'll do that for about 20 minutes, and then if you still have more questions, and we've stopped the questioning, I've asked the panelists to stick around for a little while, so you may be able to ask them directly via some schmooze time. All right? Okay, let's get this started. So anyways, our first panelist, Judy Jessen, Senior Policy Advocacy Advisor for the Alaska Caregivers Union, SEIU 775, and she's a community member. So thank you, Judy, for coming here and sharing us your expertise and your wisdom.
Can you hear me? Okay, great. Yeah, hi, thank you so much for having me. My name is Judy. I won't repeat the title. In addition to being a proud dues-paying member of this congregation, I am a proud dues-paying member to our union. We represent 900-ish home health caregivers across the entire state at the 2 largest home health care agencies in the state. So we represent caregivers who take care of mostly elders, but also people with disabilities across all sorts of, like across the age spectrum and across a really wide spectrum of needs. Our organizing has been really exciting because in addition to the proper unionizing, where we go to workers who work for a specific agency and talk to them about things that they'd like to see change on the job and the power that workers can have when they come together, we also do an arm of organizing that speaks to every caregiver in the state, regardless of whether or not they're interested in or able to unionize. And so since May of 2021, caregivers in Alaska getting organized with our movement have been a part of winning nearly $50 million for the care system in the state. We organized the two agencies that we represent within the first year of the earnest effort to organize folks into unions. I'm telling you all of that to tell you how incredible caregivers are and how much work caregivers have been doing to shore up the system. Our members do really difficult work. They do really special work, and absolutely zero of them have ever signed up to do the job because they thought they were going to get rich off of it. Our members show up for people every day. They're sometimes and often the only other person that their clients will see during the day. Most of our members already work for free, so their clients will have a certain number of hours from the state. I've yet to meet someone who felt like the hours and covered services that they had from the state were sufficient to really meet the need that their client have. So when the clock runs out from the state, our members are the ones who stay. They're the ones who show up at 2 a.m. to take someone to the hospital, even though that's not really their job. They often come out of pocket to make sure that their clients have meals, even if they're not sure how they're going to pay their own bills. And a lot of our members are in really difficult socioeconomic positions themselves. So I'm here mostly to speak to what our members are bracing for now that the bill has gone through, at least based on where things are sitting today. Caregivers are in a really vulnerable position. Most home health care services are paid for by Medicaid. Medicaid doesn't cover, except for in extraordinary circumstances, home health care at all. So your big payers are Medicaid, the VA, and then people who are fortunate enough to be able to privately pay for the cost of care that they need. At one private pay agency in town, home health care services start at the low end at, I want to say, $27.50 an hour. Many people need 20 hours or more of paid care to support them staying in their home with dignity. So you can imagine how quickly, even at the least intense level of need, the bills add up for somebody who's receiving care. For caregivers, it's not just about how much they can be paid to show up for their clients, but when we cut Medicaid, hours often get cut as a result, and that means any cut jeopardizes their client's health and their client's safety, but it also jeopardizes their job. One of the biggest worries for caregivers that they're sharing with us is the way that the work requirements are structured right now. Caregivers expect that they'll have to demonstrate sufficiently to the state that they're working 80 hours per month. For a lot of caregivers, that's not a problem. We have to think about the reality of the work that they're doing. For caregivers, that means that if their client ends up in the hospital unexpectedly, or they lose their client altogether unexpectedly through no fault of their own and with no notice, they're no longer able to work the number of hours that they would need, which could put them in a position to lose their own Medicaid coverage to be well enough to go to work at all. That's sort of front of mind for caregivers in terms of how they'll survive. It's an extra vicious cycle then, because if we see cuts to services, which people are assuring us that we're not going to, but when you cut $1 trillion out of the program that pays for these services, it seems unlikely that you could effectively protect those things from happening, although we'll be doing everything we can to be part of making sure that things are as shored up as they can possibly be. If a client's hours then are cut because of cuts to Medicaid, the hours that the caregiver is working are also going to be cut, which sort of puts them back in a position where even if they have a client, even if their client is well and their hours have historically been relatively stable, they can't really count on that either. So you have a lot of people doing incredibly skilled, incredibly important work from a dignity perspective, from an economic perspective, and from a basic human perspective, who can no longer count on being able to work enough to qualify for Medicaid, which of course we know caregivers shouldn't have to use, but many do rely on. We're still collecting data on how many of our members rely on Medicaid. Early results show upward of 25% relying on it for their own personal health insurance to make sure that they're well enough to show up for the job. In the lead up to the final vote on the bill, one story sticks out to me specifically. There was a caregiver out in Eagle River who has always worked 40 hours a week with her client. She's been really fortunate in that way. To have full-time hours with one client is pretty unusual. About a month ago, she started to get really sick, and she got so sick she couldn't go to work. She was authorized for emergency Medicaid, which expired the day of the vote. She had put in an application for full Medicaid. At the last time that I spoke to her, she hadn't heard whether she got it. She also hadn't heard about the work requirements. Unfortunately for her, until she got that emergency Medicaid, she didn't have any health insurance at all to be able to go to the doctor and figure out what was causing her illness in the first place. And now, having been out of work for a month with no real answers and no health insurance, she's, again, too sick to go to the job that she would have to work 80 hours a month to qualify for the care that she needs to find out what's keeping her so sick in the first place. So it gets to be a really ugly cycle. But more than that, most caregivers are worried about what's going to happen to their clients. Like I said before, our members have flown to DC, hundreds of members made phone calls, wrote letters, did postcards, or showed up to protest, trying to advocate for their clients, and being assured through every step that their clients' hours were going to be protected and that Medicaid was going to be protected. I'll let each of you decide how well that bared out, given the situation that we're in right now. Because our members certainly feel like what they were promised is different than the picture we're looking at now, there's a lot of mistrust about what's going to happen to client care. Most caregivers will say that their clients already don't have enough money to spread over all of the need that they have. So a lot of clients are experiencing hunger, things like rising copays for their clients. A lot of caregivers are really freaked out about, because if somebody that they're working for is already having a hard time paying the bills and they see an increase in copays, that person's not going to be able to go to the doctor. And we know that the descent into decline gets really steep when people aren't able to get their regular health care. Concerns for the client actually end up coming up a lot more than caregivers' own concerns for themselves, which can make it a little bit tricky to figure out with them how they make sure that their jobs are also protected. But it's ultimately part of the same fight and the same struggle. And so really right now, our members are looking toward what comes next. Our union is still finishing an analysis on how we expect things to hit in Alaska. I'm sure other panelists have already got preliminary analysis on that. Ours will be specific to what our members and their clients will experience. It will also include, though, looking for ways where we can still influence the process to make sure that clients and caregiver jobs are protected against the worst of the cuts. And so we'll be in communication with the community for sure. We expect to get the bulk of that analysis back in the next couple of weeks. But caregivers don't quit. They are incredibly talented at stretching capacity and stretching resources to the absolute limit and then some, and in fact making something really awesome about that. Caregivers are not going to stop showing up for their clients, and that means as soon as we have a good idea of where we can influence the rulemaking process at the state level, caregivers are going to be in every room, just continuing to take up for their clients and protecting their clients, and as an afterthought, protecting their own jobs as well. 10 minutes? Thank you so much.
Okay, next up is Jen. Jen is the Vice President of Policy and Advocacy for Alaska's Children's Trust. Thank you, Jen, for being here.
Good evening. I am Jen Griffiths. Alaska Children's Trust, for those of you that may not be aware, is the statewide lead organization focused on the prevention of child abuse and neglect. Our vision is an Alaska where all children and families have the knowledge, skills, and resources that they need to thrive, because that's how we prevent child abuse and neglect. The story of any piece of legislation is not really the story of how it passed a legislative body, but really the story of how it impacts the people. So tonight, I just want to spend a few minutes telling the story of how the policies in the recently passed reconciliation bill are likely to impact Alaska's children and families. So this bill was expansive. Over the next 10 years, it's estimated that it adds $3.4 trillion to the federal deficit. It cuts Medicaid and CHIP by over $1 trillion, and it cuts SNAP, supplemental nutrition assistance, by $300 billion. In Alaska, it's estimated that 28,000 people may lose access to Medicaid, and 14,000 people could lose some or all of their SNAP benefits. At the Children's Trust, we've really focused on three key components of this bill because, like I said, the bill is expansive. We've really focused on Medicaid, SNAP, and tax credits. So that's what I'm going to walk through tonight. For Medicaid, there were three key policies in this bill that impact kids and families. The first was related to work requirements. The bill requires, both for Medicaid and for SNAP, that adults now demonstrate that they are working 80 hours per month. That can be working, community service, volunteering, but you have to demonstrate that you're doing that. Even those who have an exemption still will have to demonstrate that they have an exemption in order to navigate this new process. Additionally, these work requirements include parents that have children over the age of 14. Another Medicaid policy that we're looking at closely is related to eligibility redeterminations. Currently, for the Medicaid expansion population, their eligibility is redetermined once a year. This bill changes that to every 6 months. While that may not seem like it's going to directly impact kids and families, additional, almost doubling those redeterminations is going to create a backlog at the state that will inadvertently impact kids and families, even adults that aren't part of the Medicaid expansion population. And a final Medicaid policy is related to what's called retroactive coverage. So it's that coverage that you're able to get while your eligibility is being determined. You've sent in your application and it's being processed, and during that time, if you're approved, they'll go back and they'll pay for some of those services. Right now, that retroactive coverage is 90 days. This bill reduces that to 30 days for the expansion population and 60 days for everyone else. So while we're reducing that, we're also increasing the risk of additional backlogs related to all the paperwork and barriers. So while Judy is exactly right, we're being told there aren't cuts to Medicaid, when you look at how all of those policies intersect, you can see the risk and where that lost coverage is likely to come. Even those that qualify for coverage have the potential to risk losing their coverage due to the additional paperwork. SNAP has some similar requirements related to Medicaid, same requirement for parents on the SNAP side. There's also some changes to what's called the Thrifty Food Plan. So this is the benefits. Right now, those benefits and increases to those benefits are tied to the actual cost of meals. This legislation changes that and only ties them to inflation, not the actual cost of food. So that's going to result in an immediate reduction in benefits, and then potentially what is likely to happen by connecting that to inflation is the amount of money is going to buy less food as we continue to move on. There's also a couple of cost-sharing policies in here that are really concerning. The first is cost sharing based on error rate. So Alaska has a very high error rate. Any state that has an error rate over 6% would have to share some of the cost with the federal government. This is looking at an estimated cost for Alaska of $37 million. So by comparison, Alaska spends $34 million on foster care services. So this is a significant chunk of funding for the state. And while we're trying to do all of these policies that require some increased support in administrative staff, There's a final policy in the SNAP portion that would increase the amount of administrative cost sharing that the state has to pay. So in order to implement some of these policies, they're going to have more money, about $6 to $10 million, to be able to provide support for the administrative cost sharing beyond what they currently have to provide. Finally, tax credits. This bill does include the child tax credit, and I want to make sure that I'm being very clear that this is a positive piece of the bill. We would have liked to have seen it more expansive, but it does make the child tax credit permanent, and it increases it to $2,200, which will be helpful for many families. It still doesn't make it accessible to our lowest income families. And a final tax credit piece to talk about is that this bill doesn't increase it doesn't expand the timeline for the enhanced premium tax credits, which are related to marketplace insurance. So those families that purchase their insurance on the marketplace, unless those tax credits are extended before the end of the year, will lose access to those tax credits. So yet another hit when we're talking about healthcare. Before I conclude, I want to take those policies and tell you the story about the impacts, because those policies are hard enough to listen to, right? The real concern is what the impacts are going to feel like for families. So we're going to have the direct impacts. We're going to have the increased reporting and eligibility requirements. We're going to have the additional administrative burden. We're going to have those funding gaps, right? Those are the direct impacts from those policies. But this is a ripple effect. There are going to be some downstream impacts. As these policies move forward, we're going to see businesses struggle. Our grocery stores, especially in our rural areas, as they lose that SNAP, the economic benefit that comes from those SNAP funds, they're going to struggle to stay open. Our healthcare providers are going to struggle to stay open. We're also going to see reduced access to school nutrition for our children, again, impacting their education, their health, their well-being. And finally, an increase in uncompensated and delayed care, again, creating additional stresses on the state budget, not just in the immediate years, but in years to come. So the most immediate impacts are going to be felt by our families who are accessing SNAP and Medicaid, but the ripple impacts of these policies are going to have long-term consequences on our kids and families. Thankfully, there are things that we can do. We're working to track the impacts. We're working to monitor and make sure that families know how to make sure they're accessing all of the benefits that they're eligible for, and really help to educate the public. So that's why it's so important for all of you to be here. And we just appreciate the opportunity to be able to stay connected as all of this moves forward.
Jen. Next up, we've got Jared. Jared is the president and CEO of the Alaska Hospital and Healthcare Association.
Thank you for having me, and Rabbi, thank you for putting this on. There's so much we could talk about. And I guess the first thing I want to say is, the rabbi was pretty generous in referring to me, at least, as an expert. Not meant to be funny either, but that's okay. None of us are experts. We're all people trying to figure out what's going on. And that's why I feel like it's so powerful to be in here with you, because you guys showed up. We're all trying to understand all of this information, all of the facts, and make sense of it. And it's really powerful when you do it together in an environment like this. And that's what I want to talk about is, I'm not going to try and convince you of something tonight. I have my feelings, my positions, but I'm going to just share the facts, the basic information, and you decide what you think is good, what you should be concerned about, and let's let that guide the conversation. So when this all started, and we could go through so much. We can talk about how Congress functions and the process they followed to pass this big bill. But I want to be clear. What we're talking about tonight, at least what I'm about to talk about, is healthcare. Only healthcare. This bill that passed where there was votes taken, there's a lot of other stuff in there. Stuff that you might feel great about, but that's not really the issue before you tonight. It's about understanding this one piece and wrapping your head around it and preparing yourselves. And when it comes to this piece, healthcare, we talk about it differently depending on where we're at in the process. So if you were reading the news and some stuff I said along the way, early on when this was debated, we were talking in hypotheticals. It's because the way this reconciliation process worked is we knew one thing. Congress gave itself a target that they wanted to cut $880 billion in Medicaid. That was its objective. So when we had that information, that fact, we took it and we tried to understand, okay, if you're going to do that, what might that look like? And what might that look like in Alaska? To do the math to get to 880 billion, it's extremely grim, okay? So understandably, when we were early in this process, we were talking about the sky literally falling, thousands upon thousands of people losing coverage. Very bad things. So this process plays out a little bit further, and then Congress goes through the next iteration and says, okay, we have our target. Then they started explaining exactly how they would achieve that target. So it went from hypotheticals down to very specific changes on how they'll get to 880 billion. Once we got that information, it was better information, right? We understood what was at stake. And some of the things that were at stake to get to that 880 billion are major changes to the way healthcare is provided, not only in the country, but in our state. And so going through that and using neutral sources and projections, the thought was that on average, you could expect you can expect millions of people, over 10 million people, to lose their Medicaid coverage across the country. If you take those numbers and say, well, if that average plays out in Alaska, and if it actually happens like it's supposed to happen everywhere else, we were able to calculate that about 33,000 Alaskans will lose their health care coverage. It's a fact. So we go through this exercise, we do our math, we come up with our conclusions, everyone's debating, tempers are hot, things are polarized, and the bill passes. So now more information is before us. We know exactly what has passed, we now know exactly when it will take place, and so now we can predict what you can expect. And that's where we are, that's where I am in this whole debate, this whole process. To me, this is not a time, the time for writing letters, the times, for getting frustrated and expressing. In some ways that has come and gone. Now it really is, what can I expect? What am I going to see? And that's what I'm going to tell you about right now. The premise of this bill, and I'm not being dramatic, this is a fact. The way that math is going to be achieved is by less people being on Medicaid. Because the less people who are on Medicaid, the less the federal government pays, therefore they can reduce the budget. That's how this works. And so the mechanisms around healthcare in this bill are designed for less people to get coverage. And so some of the main provisions, like work requirements, there's validity to that. The idea we want want all able-bodied people to work, right? It's not that simple. And really what the work requirements are meant to do is require someone to show that they are meeting some requirement, some expectation. And if they don't show that they've satisfied or met that expectation, they will lose coverage. And so what we are looking at is, in concept, all right, now our state, who has been sued numerous times for its inability to process Medicaid applications timely, its inability to disperse SNAP benefits, food, on time, that same team is now going to be asked to design, build, implement, and manage a work requirement system. That work requirement system is going to have to query every person who's on Medicaid that's going to be subject to this. They're going to have to create a process for those people who are exempt to apply for that exemption. And they're going to have to enforce when someone's no longer eligible. All of that is going to start January 1st, 2027. That's a year and a half away. I will tell you, from experience in the Medicaid program, rolling out a system like that takes time, takes a lot of energy and effort, and it's hard. And there will be failures along the way. So that's one example. And the problem with that example is, when it comes time to administer it, a lot of people are feeling optimistic that, well, there's a lot of carve-outs. We all have to step back. This big bill, healthcare, Alaska's insulated from it. You're carved out in so many different ways. The problem is, if you are carved out or exempted, you have to prove that. You have to apply for that. I don't have a high level of confidence in the people who are going to be tasked with administering this program, building the system, and managing it can do so effectively. And so what happens when you make a mistake in your paperwork? You lose your benefits. What happens when they make a mistake on your paperwork? You lose your benefits. That's one example. The bill also is going to require more frequent eligibility determinations, determining if you are still eligible for Medicaid. Right now, it happens once a year. This is going to change it for a portion of the population every 6 months. That's a systems change. So this team's got to build this work system, and in the process, they also have to change an existing system to do more work more rapidly. Same team. On top of that, Jen talked about this retroactive Medicaid coverage. We don't have to go into details, it's kind of confusing, but the bottom line is this: it's another systems change. So retroactive Medicaid coverage, I'm going to have to figure out how to change my system to make sure it's processing thousands, if not millions, of Medicaid claims correctly. I have to do a systems change to make sure I'm accurately checking eligibility for Medicaid, which right now, I believe we might have one of the highest error rates in the country. And I also have to build a system around work requirements. I also have to do another systems change around SNAP and how we're going to give out our food to people who don't have access to food. And we also, in the midst of all this, we have a good thing coming. It's called the Rural Health Transformation Project. That is what is being talked about, which it is a positive. It's money that will come into rural healthcare. Millions of dollars will come to our state, which is something to be grateful. I'm grateful for it. But that money doesn't just come in. Amongst all that system change over the next year and a half, that same team has to apply, create a detailed transformation project for rural healthcare in our entire state. It needs to be created and submitted, presumably in September, because it's got to be approved by the federal government by December 31st of this year. That same team, once they get their plan in, the funds come in, right? It's easy then. That same team has to figure out who's going to get these funds. Should it be all the hospitals? Should it be the childcare providers? Should it be behavioral health? Should it be home health? Should it be everybody? Well, that means you got to create a system for people to apply. And you have to determine from those applications who gets the money. And then you have to report on that. And it goes on and on and on. And so my concern at this point, and I'm going to wrap up here, is that if you look at our healthcare system today, and you read the news this morning and realize that Alaska, 3 of its cities have the highest healthcare costs in the country. If you think our healthcare system is great today, you would be lying. I work in the healthcare system. I represent the healthcare system. I'm proud of the healthcare system. I think we do incredible things, but we have a long way to go. When all of these things happen, you are going to make people's ability to get basic healthcare services harder. Is that a good thing? We people are here discussing this. Is that what you want for people, for it to be harder for them to take care of themselves? I don't think so. And the problem I have is what you can expect when all these things will happen, they're not going to happen until 2027. Everyone's going to forget about this. Everyone's going to go, we passed that bill, I promise I'll wrap up. Everyone's going to forget, and it's going to feel like nothing happened, and then it's going to be a trickle. And you'll start seeing people lose eligibility. And then you'll start hearing providers complain about all these problems administratively. Then you're going to hear about the state doesn't have enough resources and power to actually do all of this. And then we're going to look back and realize we're in a bad place. And I can guarantee you that what you will see in a few years in healthcare will be a healthcare system that is worse than it is today. So if you feel great about our healthcare system, it's not going to be like this in a couple years. And so that's something we all have to leave tonight and think about. Maybe you agree with everything else that was in the bill, and maybe that's an okay trade. You know, that's not my judgment. But what you need to know is what is in front of us is incredibly challenging. It's a daunting road, and it's not going to be something you're going to see in your face every day. The sky will not fall, but the system is going to experience a lot of pressure. So I feel it's wrong to say thank you after all of that, but thank you for letting me be here tonight.
Thanks, Jared. Up next is Representative Mina, the chair of the House Health and Social Services Committee. Representative Mina.
Thank you, everyone, for coming this evening, and also just thank you to all of our presenters here. I'm surrounded by a lot of really incredible advocates and policymakers and people who have been really ingrained in this bill process and trying to understand what the bill is and its impacts. And so I don't want to be too duplicative of my previous speakers. I want to focus more on the actual system of our social safety net and what we're going to do about this bill in the coming months. I think there's been a lot of talk about the actual bill itself, right? And it is a bill that saves money by kicking people off the program and creating tax cuts for very affluent folks. But moreover, this bill is looking at trying to dissect our social safety net and figuring out what are the problems with it. Well, as a state legislator and also as chair of the House Health and Social Services Committee, I've been following the issues with our social safety net. When I was first elected in 2022 and started serving in 2023, that was about the same time that the state was experiencing the huge SNAP backlogs. And I'm sure a lot of people in this congregation were seeing headlines of people that were going hungry, elderly individuals that were being forced to eat pet food because they couldn't afford food for themselves because they were waiting on SNAP. And it was a hugely significant issue in my first year in the legislature. When I was in the Health and Social Services Committee, we had numerous presentations from the Division of Public Assistance and from the leadership of the Department of Health of what was going on. And so I'm in this frustrating position on a state level because I'm in communication with my own constituents on a regular basis. I hear from Alaskans and other districts who are also suffering because they're not getting their SNAP and Medicaid. But then I'm also seeing these changes on a federal level and in attempts to try to fix a safety net. The problems that I see with our social safety net isn't waste, fraud, and abuse, and I haven't met the person who doesn't have income and has huge savings and is leeching off of SNAP benefits, and I haven't met the person playing video games in their mom's basement. I probably wouldn't anyway, because they would be in the mom's basement, but that's not happening. People who are on these safety net programs generally work, and if they're not working, it's because they're taking care of somebody, as Judy was saying, or they are going through other conditions in their lives. But for the most part, these programs are really effective. SNAP is the most effective anti-hunger program in the nation, and Medicaid helps people work and make sure that they go to their jobs. It helps families out, especially if you're a single parent and you have a lot of children. And additionally, Medicaid saves lives. That's huge. So we're not seeing these issues that people aren't necessarily working. The big problems with our safety net is with our system, and it really dates back to the Division of Public Assistance. So I want to give a quick timeline going back, because before I was elected, I was also a staffer. And I remember staffing in 2021 and 2022 and watching Representative Josephson, Representative Liz Snyder, Representative Ivy Swanholtz fight on the Finance Subcommittee for Health and Social Services because there were vacant positions at the Division of Public Assistance that the governor eliminated, and they fought to reduce the number of positions that were eliminated. So then what happened is that when there was the pandemic, the Division of Public Assistance stopped checking your income levels to see if you were eligible for SNAP and Medicaid. But then a few years later, they had to start checking that. And so you had this huge onslaught of bureaucracy for less people at the Division of Public Assistance to now deal with literally everybody in the program to make sure that they were still eligible. And that is a backlog that has continued to reverberate onto Medicaid, onto other programs, and the ripple effects are continuing on today. I'm still getting emails from people who are in Sitka and from other areas just to keep me updated that they've still been waiting and they can't schedule an appointment because they can't get an appointment if they don't have an active Medicaid card. And then they get an active Medicaid card months later when the previous eligibility window expired. And from single parents of 5 kids who are waiting months and months for their SNAP. So it's a huge situation that we're facing. What the legislature has done over the past number of years, we've spent at least $60 million, $70 million. I'm sure Rep. Josephson, being part of finance, knows those numbers better, to be able to help alleviate this problem. Most of that money went into upgrading the technology for processing SNAP applications because we were using a programming language from the 80s. Additionally, we've spent a lot of that money contracting out a lot of the positions in DPA, the Division of Public Assistance, so that there are more people to answer the phone calls. Well, if you know anyone who's tried to call DPA, it will still take you hours and hours to get a hold of someone. And also, we're in a position where the DPA office is currently being renovated in Anchorage, so you can't even wait in line for hours, without a chair. You can only call. So take everything that everyone else has been saying and think about the Division of Public Assistance. And really, it's not the workers' fault either. The people at the Division of Public Assistance, I've talked to a good number of them, and they hurt as much as the people that they are working with are hurting. The people who are there, who have been there for quite a bit of time, they've seen a lot of the changes at DPA. They've seen the changes in the process of how we do our applications, but they've also seen the changes in terms of the turnover. And one of the biggest things that the folks at DPA have been telling me is the matter of a pension and the fact that they have a defined benefits and the new people that they see at DPA don't have one. It takes over a year to train one eligibility technician at the Division of Public Assistance. And part of that is because we have the most public assistance programs compared to any other state. Other states don't have programs like heating assistance, et cetera. So there's that situation. Now, with the budget reconciliation bill, a lot of our issues with trying to comply with getting people their benefits on time is related to the federal requirements related to SNAP and making sure that you're checking their income levels every 6 months, 12 months. There are people who already follow all of the rules and they still have to wait for their benefits. They might have missed submitting a piece of paperwork directly on time, and then they lose benefits. And the thing about the error rates is that the way that they work, the error rates aren't because people are committing fraud, but it's because the state isn't following a bureaucratic step related to the federal requirements of the SNAP program. Part of the reason why our error rate is the highest in the nation is because the state was so behind on everybody getting their benefits on time that they were intentionally and reinterpreting some of the federal rules in order to not check someone's income eligibility multiple times a year, and just making sure that people were getting their benefits because folks were literally going hungry. And so it was this difficult situation between, do we comply with the federal regulations and delay benefits when they've already been delayed, or do we break them and just bite the bullet and face the fact that we're going to have to pay a fine so people can feed themselves? That's the situation that we're in. Now, moving forward, the areas that I'm concerned about, and I think Jared elucidated them pretty well, by the end of this year, the state is going to have to apply for good faith waivers to delay the implementations for both the Medicaid work requirements and I believe also the SNAP provisions in terms of the cost sharing. We're not going to see this huge impact that a lot of partners and stakeholders we're looking at in terms of costs to the state. And before these final changes in the bill, we were looking at adding an additional $250 million a year to our annual state budget. Right now, and from a conversation that I've had with Senator Murkowski's office and also with the leadership at the Department of Health, we will have to pay that $10 million for the administration for SNAP, and that's going to continue on. We're going to have to delay some of the costs related to the error rates, but in order to not share those costs, we have to get our error rates lower than 6%. And from what I've heard from the senator's office, we've never been under the 6% error rate. So the general summary of the situation is that we're going to have to get our error rates down, which we've already been paying penalties for, then also apply for all of these different programs in order to delay the implementation of this bill. Also apply for funding for the Rural Health Transformation Fund on top of funds that all states are going to get from the Rural Healthcare Transformation Fund. And we can't do that if we can't support the Division of Public Assistance. So when I think about what Alaskans can do now that we're to a point that this bill has passed and has been signed into law, are two main things. First of all, support a defined benefit. I've heard that from the DPA workers that have been there for a long time and they've seen the changes, and they will loudly proclaim that they need a better retirement system for a lot of the workers that they're in that division, or else they'll continue to see this churn. And House Bill 78, we passed that out of the House. It's on its way through the Senate, but that will make a huge difference for state workers, like educators and public safety individuals, but also our folks at DPA who are the benefits on time. And the second action would be to speak up if you or someone else you know is experiencing a delay in benefits or will experience a loss in coverage for benefits that they should be eligible for, whether it is Medicaid or SNAP or anything else. My biggest pain that I see when I got an email recently last week from a constituent that just said, House District 19, the area that I represent, Airport Heights, Mountain View, Russian Jack, House District 19 is hurting. And it's because she knows so many people who haven't got their benefits. For all of those folks, and for this person, she didn't know that she could reach out to my office where we directly engage with the Department of Health and they directly respond to us when a constituent is behind on their benefits. Let people know that they can contact their legislator. And if they don't hear back from their legislator, reach out to me, reach out to another person's office, but our offices are here to help. Ultimately, this is a bill that is trying to fix the safety net, but our safety net is a weird system between the state and the federal government, and the more that we try to create more accountability through bureaucracy, that bureaucracy is dependent on people making sure that they're delivering basic government services to people. And when we fail on that, that makes the difference between someone being able to feed themselves or being able to be well. Thank you.
Okay, thank you, Representative Mina. Next up is Representative Josephson, who is the co-chair of the House Finance Committee, and he is a community member.
Good evening, everybody, and thanks for coming out on a beautiful night. I am going to, there's so many different lanes I can go down, and I've adjusted them based on these wonderful, although sad comments from the other speakers. I'm going to try and make sure that I anchor my comments to what it's like in the Finance Committee to try to navigate through these issues. So the first thing I would say is I'm thinking about Jared's predecessor, Becky Holtberg, who's gone to Oregon, very competent as Jared is, running the Hospital and Healthcare Association. And she was there as president of that association when Governor Walker expanded Medicaid. And even though we were then in an oil recession, we're hard to argue that we're in that now, but we're certainly then, and times were tough. We had more savings, but the trend line on these issues looked better, I think. And now that trend line is going to be reversed. And I want to tell you about why I say that. So we have to hang in there together. So the first thing is, there are so many obstacles to meeting the needs of the Alaska people. One of the things I do as chair of the operating budget on the House side is, as I'm sure Representative Mina does, I have meetings with everybody who flies to Juneau and asks for a meeting, all of them, right? There were about 100 meetings like that last session. And typically, folks say, we need this for the deaf community, we need this for those suffering from Alzheimer's, we need this for the SEIU to help personal care attendants, that sort of thing. And I put those things on a list and I fight for them. And there are very few, much less than 2%, that one might call frivolous. We had some successes winning some things this year. So I see my friend Gordon Glazer, we got more money for senior centers. He's very involved, as you know, in the senior community. We got more money for behavioral health grants. Senator Wielechowski, who represents this area, was very instrumental in that. We got money for childcare grants when it seemed that couldn't happen. And so we got money for child advocacy centers where experts interviewed children who've been sexually abused. And the federal funding source had dried up. We had to use state dollars to fund that. And of course we did that. So we're able to get some wins, as I call them. This is going to be more difficult. And the reason is the governor has shown early in his time, for example, that he was willing to get rid in the Medicaid program of adult dental. Well, when you get rid of adult dental, you're left with treating abscessed teeth, and that's more expensive and more painful. But he was willing to strike adult dental from the state plan through something called the State Plan Amendment, or SPA. And this is a process you have to go through the federal government. There was great protest over it. What I've been trying to do as a legislator, and I had a bill to do this, was to expand what are called the optional programs. Becky Holtberg, who I noted, had testified about how some optional programs are things like, this is Medicaid I'm talking about, are things like pharmaceuticals. That's optional. Weird, right? So don't be misled by that term. But now we're going to be in a situation where the state is going to have to ask itself, and this relates to these budget issues, the state is going to have to ask itself, does it want to maintain the status quo? And my staff has informed me that if the state loses, for example, $200 to $300 million in federal fund Medicaid expenses or expenditures, appropriations to Alaska, we will need an additional $100 to $200 million each year to replace those lost funds. Apparently, that starts in January of 27. Well, we look at the FY27 budget next January, right? Because that starts in July of 26. So it may sound, Jared talked about how it'll seem like it's out there a ways, relax. It's not out there in that way. And so there's great concern, and part of my concern is twofold. Will the majorities in the legislature, will they continue to show compassion? I wanted them to show more compassion for the needy, for folks in the deaf community, the Alzheimer's community, the in need of subsidized childcare, the list goes on and on. Will they continue to do that? Or will they retreat and say, we just can't afford these things anymore? Because the legislature is not a place of great courage when it comes to, for example, taxing you all, right? You're the only Americans who have no broad-based tax. No broad-based tax. There are other reforms that could be made on corporate income tax and the like. But if you shadowed me for a week in Juneau and you just watched random hearings, whether it was on public safety, healthcare, et cetera, you would say the fact is the state doesn't spend enough money to meet the needs of its citizens. We know this in education, right? This is a no-brainer. We are hundreds of billions of dollars short of reaching the inflation adjustment that the students need. So what I do is I chair the operating budget, and then I've delegated to myself two important tasks, two difficult tasks. One is to be the chair of the Department of Health Finance Subcommittee. So I walk into Chairwoman Mina's office, or rather her committee room. She kindly loans me her gavel, and we listen to testimony from the department about what its needs are. Well, that's a whole nother level, because we don't know there's certainly some honesty there, but they are delegates, if you were, as it were, of the governor. So we need to dive deep and ask, what are the real needs? You've told us that OCS is fine, the Children's Services Office. We don't believe it. Tell us what the real needs are. And we're supposed to hunt those down. And if they are not allowed to ask for increases, then they're not allowed to ask for increases. And so we have to decide what the truth of the matter is. And there's going to be a lot of that related to this bill. So we have a governor who may come to us in January, the budget comes out in December, and says, we're in retreat. We have to, and he may say, we simply don't have the resources. Now, He has said that about education, even though we've left something like $180 million that could have been spent, for example, on education or healthcare in the Treasury, now swept to something called the Constitutional Budget Reserve, a lot of it. So the task is daunting. I'm worried, this is just going in the wrong direction, right? It's what Jared said about 11 million Americans not enjoying coverage anymore and having to fight for what they have. I'm remembering Governor Palin talking about death panels. You want to talk about death panels? I mean, someone's not going to get their colonoscopy. It's not going to happen, right? And the other thing that Jared, and he could have talked to you brilliantly, as they all could have, for an hour, but he could have told you that one of the problems with not providing Medicaid as we were, with the trend line doing this under Obamacare, where there was expansion, there's still expansion, but the work requirements are tough, is that people will get sick. So they'll go to Providence and Alaska Regional, they will get covered, and all of the rest of us and our employers will have adjustments to those premiums and copays, right? So this is not good. And one thing I would ask, frankly, is about there are many questions, but the Rural Health Transformation Fund. All right, I'm not an expert in this. There are rural hospitals, we call them, like Petersburg and Homer and the rest. Presumably they are going to be eligible. But what does that have to do with cuts to Medicaid? I don't know. And as Jared said, I keep quoting Jared, we're all learning about this. I don't frankly have the time yet to read a 950-page bill. That's the primary source, right? We're reading secondary sources. And by the way, it's a moving target because there's going to be waivers that we're going to seek from the Secretary of Agriculture and SNAP, and the list goes on. And there's going to be rulemaking. So I'm very disappointed. And I think this is going to be sloughed off on the states. And I just don't know that we have a state with a spine to stand up and say, we need to invest more in Alaska's people. We just need to do that. And by the way, even when the legislature does do that, the governor will often veto. Now, he doesn't always veto. So for example, we wanted, I think it was $7 million in cash grants for childcare, and the governor gave us $5 million. Well, that's $5 million. But sometimes we knock on the governor's door and he opens it. So it's going to be tough, and I hope that's helpful. If there's anything that we can answer at the end, I'd be happy to try to do that. Thank you.
Thank you, Representative Josephson. And next up is Karina, who is the Senator Murkowski State Director. Thank you, Karina.
Hi, thank you, Rabbi, and the community for having me here tonight. I am not a public speaker, unlike those on the stage, so I'll probably read a little more off of my notes. Sorry the senator couldn't be here. They are obviously back in DC dealing with a rescissions package that's currently on the floor right now. The point of me coming tonight was really to hear from all of you and from the panelists about any questions or concerns that you have about the bill, so I could take that back to the senator and our policy team as we're looking forward after the passage of this legislation. First and foremost, for 22 years, Senator Murkowski has been guided by one principle, and that was protecting Alaska and its residents. And that was no different in this legislation. She was faced with a very difficult choice, one to work really hard to mitigate any impacts to this bill that were coming down the pike, or she could stand aside and let it go without her doing that. But I just want to ensure, because there's been misconception in social media and other places, that had she voted no, the bill would have failed. That is false. they had a senator waiting in the wings who was ready to step up to the plate and vote for the bill, as long as all of the special provisions that were in here, all of the delays to the state, the rural hospital fund fell out. So we would be faced with legislation that would have devastated Alaska. So I wanted to start from that point, that when faced with that choice, Senator Murkowski made the only decision she could, was to try to mitigate the damage and do what she can first for Alaska and then for the rest of the United States. And so that's what she did. So today I'm going to kind of walk through. I have a rundown from our policy team who was negotiating for 48 hours straight with the senator without sleep on some of these things. So on Medicaid, the Medicaid sections do not include any direct cuts to Alaska's federal match for Medicaid. There are no impacts to traditional Medicaid beneficiaries. So those are the populations that include low-income children, pregnant women, seniors, people with disability, and low-income parents. The bill does address those in the Medicaid expansion pool, which was expanded in 2015, I believe, under Governor Bill Walker. The bill's workforce requirements are only applicable to those. This will require adults, with exceptions, that I'll go through, to either work, volunteer, or study for 80 hours per month. The people that Senator Murkowski was able to get exempted include tribal members, individuals temporarily relocating for medical care, veterans with a total disability rating, individuals who are medically frail or have special medical needs, individuals who are blind, have a substance abuse disorder, a disabling mental disorder, a physical or intellectual disability that significantly impairs their ability to perform activities, parents, guardians, or caretaker relatives of children aged 14 or younger, or of a disabled individual, foster youth through the age of 26, and individuals who are or were inmates of a public institution in the previous 3 months. So those are the people who are exempted from the Medicaid expansion work requirements. She was also able to secure a delayed implementation of these work requirements for states that are working in good faith to try and revamp their systems, which the state of Alaska is expected to have completed in 2028. We've heard talked about the Rural Hospital Transformation Fund. Senator Murkowski was able to secure an additional $25 billion to bump it up to $50 billion fund. That's not only for the state of Alaska residents, but that's across the United States. On SNAP, the final Senate bill, had there not been any negotiation at the end, would have cost the state of Alaska tens of millions of dollars in fees and resulted in a loss of benefits to numerous SNAP beneficiaries. She worked to address that by including changes such as exemptions for work requirements, delayed cost-sharing penalties for Alaska, and work requirement waivers that align with Medicaid policies. I'll walk through a couple of those right now. For the work requirements, knowing that many Alaskans live in areas where work, volunteer opportunities, or education or training are simply non-existent or difficult to obtain, there are exemptions for tribal members, for parents or guardians of children aged 14 and under, and in areas of Alaska and Hawaii where the unemployment rate is 1.5 times the national unemployment rate. So basically everywhere in the state other than Anchorage and the Valley and maybe one other city. And she was able to secure that for both Alaska and Hawaii. She also secured another delay of those. So there is a 2-year delay of the work requirement expansion in non-contiguous states in order to give the state time to get its systems up and running, and to work to identify any deficiencies before the program actually takes effect. We've heard a lot about the error rate, right? So the state has had significant challenges for a whole host of reasons, and your representatives kind of gave a great overview of where we stand right now. But the reality is the state has a 24.66% error rate, right? Which is in violation of federal government requirements. One way that Congress was looking at making some money back is by penalizing those states with high error rates and forcing them to do more cost share, which would have been devastating to the state of Alaska. So now there is a delay in that for the state of Alaska and others that have a high error rate. They essentially have a delay until fiscal year 2030 to get their systems up and running and bring their error rates down before any penalties will start to accrue. We understand the difficulties that the state is operating under, which is why not only the delays are built in, but we have commitments, Senator Murkowski secured commitments from the administration, Secretary Rollins, Dr. Oz, and Secretary Kennedy, to work with our state team on developing the systems that they need to implement any of these changes to ensure that Alaskans can meet the requirements under the law. So, and I just want to say, and our office is committed to being a part of this process and working with the state and the administration to make sure that going forward, we're doing everything we can and the state has all the support that they can to upgrade their systems to meet the requirements under the law without harming the populations that need Medicaid and SNAP. Those include investing in systems and focusing on workable solution for rural Alaska and make the paperwork requirements work for our state. Streamline SNAP and Medicaid systems where possible. Focus on sustainable systems and services for people. And assist the state in meeting deadlines, such as the December 31st, 2025 deadline for the Rural Hospital Fund. In the future, this was brought up before, we're looking at legislative initiatives this fall on extending the enhanced premium tax credits and making changes to SNAP and Medicaid as we see issues arising from this legislation. A couple of other things I wanted to mention. I will follow up with my staff on whether you had mentioned the individual who had lost her job and so lost her benefits because her client was in the hospital and she got sick and was in the hospital. I believe there's a grace period built in, but I need to follow up with them, so I will follow up on that for you. So I just want to say on behalf of the center, we understand that this is a lot to take in. This bill was massive and it had a number of significant changes. Many of which, because of the quickness and speed with which it was passed, weren't well understood or communicated out to communities in Alaska and in the lower 48. So we are committed, myself, the senator and her team, to coming to events like this to talk with individuals who are concerned. If we can do it on a broad level. Also, my state team does casework. So if there's an individual case where you're having an issue getting Medicaid or SNAP, you can reach out to our office. We're quickly coming up on the August work period, so the senator and all of the staff will be in state. We will be convening ourselves a number of small group meetings, so the senator and her senior policy team can talk to individuals like you guys about the bill, your concerns. And I do want to relay, this is not the end all be all. Congress passes legislation on a regular basis. Sometimes they pass bills, they recognize there are deficiencies in those legislative initiatives, and so they go back and they work on fixes. So as we identify where the problems are in Alaska, we can work together to try and resolve those issues. But that's all I have. So thank you for allowing me to speak to you.
Thank you, Karina. So last up is Diane. She is a community member, and she's going to help us look forward and be speaking about the Corporation for Public Broadcasting Zero Out of public media funding. Thank you, Diane.
Thank you, everyone. Today was a busy day. Right before I came over, as I was coming over, Vice President Vance cast the tie-breaking vote that moved the rescission bill. They'll go on to the floor of the Senate and probably be considered tomorrow, maybe wrapped up tomorrow night, but certainly by Friday. So in the what can you do, there's still opportunity. And if you haven't already contacted your senators, this may be your last time to do that during this process. So a little about me. I moved up to Alaska in 1983 for 2 years. And I guess it kind of, I took to it and it to me. I came up to run the Alaska Public Radio Network, which was in its infancy. I was the 4th executive director in its first 4 years of existence. During my tenure there, my husband, Mel Sather, and I helped to build about a dozen news stations in rural areas that had no media services: Unalakleet, Chivak, Fort Yukon, Sandpoint, Unalaska, Pribilof Islands, etc. Valdez was one of them. The Corporation for Public Broadcasting is not something that most people have ever heard of, nor should it be, but it has an interesting tie, its creation, to Alaska. My understanding is that when the Carnegie Corporation, Carnegie Foundation in New York, did its study on the future of public television, they crafted legislation, brought it to Congress to create an entity that would serve as a recipient of federal funds to be stewarded and distributed to public media stations across the country. And it was to be called the Corporation for Public Television. Well, in Alaska at that time, we only had public radio. We didn't have any public TV. So according to the story, Senator Bob Bartlett said, if you want my vote, it's got to be called the Corporation for Public Broadcasting, not the Corporation for Public Television. And that's where the name came from. When he was in the legislature, Willie Hensley said, or after looking back, said the most important vote he ever cast was to create the first public radio station, KYUK, in Bethel. Because at the time it came around, very important things were happening to rural Alaska, literally to rural Alaska, that people were completely unaware of. And it was only through creating these rural stations that residents of those communities were able to follow the policymaking, the news, the actions of the federal government, state government, that were having changes that would be forever upon these communities. CPB today has about $500 million in funding, and it was created to be, and it says so all over the legislation, and even when President Johnson signed the bill, he talked about this: free of government interference, free of any kind of political pressure. And that's why the funds for the corporation are appropriated 2 years ahead of time. So there can't be any knee-jerk reaction by the president or Congress to take action against the funding because they didn't like something they heard or saw. So what is being rescinded at this point, or the effort to rescind, is money that was already appropriated by Congress for 2026 and 2027. And what this would mean is that there would be no money in place for the coming years ahead. And we don't know what will happen. Karina would know better than I on any sort of new appropriations bill coming up. This has nothing to do with money. It has absolutely nothing to do with the deficit. It has nothing to do with spending. This is purely about content. We have 53 Republican senators, and 52 of them hate National Public Radio. And that's just the way it is. They feel it's biased. They feel that they haven't been treated fairly. And this was fueled by a member of NPR's own staff, a guy named Yuri Berliner, who wrote a piece about a year ago in another media claiming that as an editor for 25 years at NPR, he now believes there's no room within NPR for alternative points of view, that the organization has changed in a way that is not appropriate. A lot of people believe that's the case. If you are largely in agreement with some of those points of views, it probably doesn't bother you that much. But if you're not, and a lot of the issues that are brought up have to do in Alaska with development versus environmental kinds of things, with climate change, with you name it. But the truth of the matter is, I mean, even Susan Collins, I don't know if you watched any of the hearings, feels very strongly about NPR's bias. And agree with it or not agree with it, that is what's going on right now. It has nothing to do with Sesame Street. It has nothing to do with KSKA. It has nothing to do with Kiwanis Broadcasting. It has nothing to do with Molly from Denali. It is simply, how do we tell NPR we're pissed off at them? And the way Congress set up the corporation, you can't do it. They purposely set it up that way that you can't reach in and control content. So all the way through the legislation and the way it's structured as forward funding, you cannot reach in and do it. National Public Radio today gets 1% of its funding from the Corporation for Public Broadcasting. They get additional funds from stations who receive grants and purchase NPR programming. Congress has been trying to figure out, the president tried to figure out, certain members of Congress, how do we reach in and stop the stations from taking that federal money and using it to support NPR? The 1% was addressed in the executive order, saying you can't use CPB money for PBS or NPR. But as I told our senators, you can vote for this thing, but NPR will be perfectly fine. Half the Alaska stations will be gone. National Native News will be gone. Native America Calling, the NV Satellite, Molly from Denali will be gone. And that's why there's been a frustrating period of time here, and in the last few days, amendment after amendment after amendment, trying to figure out how to do this without harming the local stations, but there really isn't a way to do it. So that's what we're seeing right now. And what it looks like is going to happen is that there will be some kind of carve-out in the rescission bill, which I think will probably pass. My feeling, I hope I'm wrong, and I often am on these sorts of things, but that will protect in some way native, they actually say tribal stations. So some of the conversations I had today is, well, wait a second. Mike Rounds from New Mexico was saying, I want to protect the tribal stations, and we're going to get funding through the Bureau of Indian Affairs. And this is me and my colleagues saying back, well, wait a second. None of our native stations in Alaska are tribal. They're licensed to community groups. They're licensed to school districts. They are not eligible for BIA support. That doesn't work for Alaska. And what about Ketchikan and Petersburg and Haines and Kodiak? They're not tribal stations. They're not native stations, but they are also the only service that those communities have. So one of the things that happened on April 28th was an executive order that basically, well, it's actually a letter that 3 of us got. We have a 9-member board. There are 5 of us now, 2 Republicans, 2 Democrats, and me. I'm an independent. And the 2 Democrats and I received a letter saying, you, on behalf of Donald J. Trump, you are hereby terminated as a board member of the Corporation for Public Broadcasting. Thank you very much for your service, effective immediately. We filed suit the same night, all 5 of us, and we were reinstated the next day by a federal court. Today, this will probably be in tomorrow's newspaper, but today we were all sued by the Justice Department, my two colleagues and me, for more or less practicing without a license, saying that we were terminated, but we're still acting as if we're on the board. So it's a 17-page complaint that was filed. I feel like the life's work of hundreds and hundreds and hundreds of Alaskans is at risk. Our ability to have any sort of fair process for people to know what's going on in the state. And you can't have a democracy without an informed public, let's face it. So to me, this is really a disaster waiting to happen right now. I'm really sorry the way things went today. I'm hoping somehow there's going to be a fix in the next couple of days. And if not, that we're going to see somehow through the appropriations process that our senators are going to try and save the day and keep the system afloat. So it's dire. If you haven't done anything yet, time to do it. We're out of time. And I thank you. Thanks for the invitation, and appreciate it from all of you. Thanks.
Thank you, Diane. Okay, we're now going to open up to questions. Trying to decide how to do this. I think what we'll do is that we should probably ask a question from a specific individual, and they'll come up to the podium and answer. Maybe that'd be the easiest way of accomplishing that. Yeah. All right. So if you have any questions, please come to the mic. Let me turn it on real quick. You can start asking away. Yeah, I think tomorrow.
Hi, Karina, could you tell us if there's a place where those exemptions are listed and we can look them up?
So we are working right now on pulling together something for the public. I know there are other groups and organizations that are working on it as well. We are hoping to have it before tonight, but not quite yet. I mean, it is listed if you want to read the legislation.
Easy bedtime reading.
But I could share it with Rabbi, the list that we have, and then he could share it to however you notified your members of,
Okay, thank you.
So happy to do that, yeah.
Breakfast at Andy, I'm Gordon Glazer. Nice to see you here. Thank you for your comments. So what's the next step for us? I mean, the reality of it is the legislation's going to go in. I'm sure there'll be suits, et cetera. We're going to be facing the legislature coming up. What's the next step for us, Andy, in terms of an informed public trying to influence the direction of where we go from here?
Well, one thing that's going to happen in January, first of all, Representative Mina plans to hold a hearing at some point. She'd calendared the thing, and then there was a firestorm over the passage of the bill, right? This is not a point of argument. And she smartly postponed that for people to do their fact-finding. So that's going to be an important interim hearing. I suspect that's going to be calendared in August or something. In January and February are intense months in Juneau for the operating budget, where we hear from the departments, and they will report, and that will begin in mid-December with the governor's budget, on their anticipation of the proper state response to everything you're hearing. So, and then we have to look at what we can afford. Is there, I mean, I need to meet with Senator Murkowski's staff and see the nature of the carves out and the exemptions from rules and how long they last, and get a better sense of that. But what I believe is that we're going to be severely budgetarily impacted. And so will the legislature assert itself and say, no, we want the status quo? Whatever we had before wasn't perfect. We were trying to grow that, but we want to fight for that. Or will they say, oh geez, we don't want to draw from any savings because that takes a supermajority vote. You may know about the Constitutional Budget Reserve, et cetera. Or maybe the price of oil's higher, so hey, we can skate by. After all, it's an election year. It's sort of a tiresome, cyclical series of comments. But I think all of us need to study these issues more, and then for state purposes, state government purposes, January and February and March are where the rubber meets the road.
Since it's a little bit slow, it's more of a comment, if that's okay, but please extend my thanks to Senator Murkowski for making the bill less bad, but please also convey that it still sucks. She conveyed support for the tax cuts. She expressed support for the tax cuts. My family is in a fortunate position and we actually benefit from them, and I would gladly give them up if it meant that lower income families were eligible for the increased child tax credit. And for our state folks, tax me already. I am willing to pay for the things we need to provide.
All right, y'all. I'm going to cut it off there. Thank you so much for your questions and comments. I recommend you stick around to eat some food for our nosh and our potluck. I want to thank our panelists one more time for being here. Thank you so much. And if you want help, if you represent a community, you want help running your own symposium, please ask me. Happy to help with that process. I think they're really important to do, and to keep the conversation going as we get closer to these deadlines. All right, y'all. Thanks again for being here. I really appreciate it, and hopefully we'll see you eating some food. I really appreciate it. Yeah. There you go. Nice job.
Thank you. No, I'm already in grade school. Nice to meet
Sam or me? Oh, hi. It's nice to meet you, Skip. I'm Jared. Hey, okay.
I heard all this was a working session, crying and blowing and so forth. Not one person talked about the source of the problem. Not one talked about the fact that Sullivan is never here. Okay, why would he also vote for everything that's against us? And nobody said anything. Okay? Murkowski I was happy with for a while. But she's got her. She's in a ring. Who's doing the ringing? Okay, we've got the orange turd running the world. Stacey Abrams has written a book. Came out on the analysis of the conflict of our okay, she says we're 2 steps away from autocracy. What's going on? Why aren't we doing something? What is it that's threatening these people?
That's a great question.
I've watched them vote. I've never seen everyone frightened in Murkowski when she cast her vote in that second impeachment